So meditation is known to be good for mental health, and particularly mindfulness meditation has been shown to be great for anxiety and depression. And in fact, there's a lot of scientific evidence to actually show how mindfulness practices can help reduce anxiety and depression, and that's exactly what we're going to be reviewing in today's video, so stay tuned. So before we get into the science behind mindfulness and mindfulness meditation, we need to understand what exactly is mindfulness. So mindfulness, to sum it up, is basically keeping your complete attention on the experience and present experience in a moment-to-moment basis that is in an open and non-judgmental way, which may sound easy, but in fact is very difficult to do. You see, mindfulness encompasses several things and several factors, and that is the present moment awareness, the non-judgmental observation, acceptance and letting go, as well as compassion and self-compassion. And in fact, mindfulness is the opposite of mindlessness. And the reason why mindfulness is difficult is because we often are stuck in mindless activities and mindless thoughts. And mindless things can be things like rushing through your daily activities just to get them done and not even thinking about them. It's basically doing things on autopilot. It could be breaking or spilling things in the process of maybe cleaning or doing some house chores because you're not being focused in the present moment and not being attentive to the things that you're doing. Mindlessness can also be failing to pay attention to the physical tension or subtle changes in your body that can oftentimes result in anxiety. Part of generalized anxiety disorder is the tension in your neck and shoulders, and how oftentimes people can get stuck up like this in their body because they're so tense. And that happens gradually over time without us even noticing it until it gets to a point where we start experiencing lots of pain in our neck, shoulders, and even back due to this physical tension. Mindlessness also finds ourselves stuck in either the past or the future. When you're mindless, it's hard to be present in the here and now. Mindlessness can also be doing activities, like I mentioned earlier, without even thinking about it. And this can be eating or snacking without even thinking about it, even when you're not hungry, which can lead to things like binge eating or stress eating when you're anxious. And so incorporating mindfulness into your daily practice can actually help to alleviate those things and get us out of our everyday mindless practices. And there are many types of mindfulness practices. There's obviously mindful meditation, which is what most of the science and literature looks at. There's also mindful eating. There's mindful walking. You can go for a walk and be mindful. There's mindful driving. You can be mindful while driving. Mindful exercises, specifically exercises like yoga and stretching, as well as mindful relaxation practices where you're focused on the breath. You see, mindfulness doesn't necessarily have to be in a meditative Zen-like state. You can practice mindfulness, present moment awareness in everyday activities. It's all about the pause and just being in the present moment and being an observer of where you are in the here and now. And it's all about incorporating those basic principles of mindfulness into your daily activities, like the present moment awareness, the non-judgmental observation, so not being judgmental to what you're seeing or even thinking, as well as accepting and letting go, for instance, if you're feeling tension, as well as compassion. The non-judgmental aspect of it allows us to let go of our negative thoughts and be compassionate towards ourselves, because we all have negative thoughts. In fact, they say that anywhere between 80 and 90% of our daily thoughts are actually negative. So it takes some effort to get out of that and to be focused on the present and to actually not be judgmental of those negative thoughts. And so there's many forms of mindfulness, but there's also different types of mindfulness practices that are used by clinicians and therapists to help treat patients with anxiety and depressive disorders. So things like mindfulness-based cognitive therapy and acceptance and commitment therapy, dialectical behavior therapy, as well as mindfulness-based eating awareness training. So there are many forms of mindfulness that are used in clinical practice. And the benefits of mindfulness are many benefits throughout the body, not just mental health. Of course, mindfulness has been shown to reduce anxiety, our stress response, as well as to improve mood disorders and specifically depression. Mindfulness also has been shown to help improve cardiovascular health as well as immune system health. It's been shown to reduce inflammation, blood pressure, heart rate, and help overall with overall physical health as well as mental health. And the science and literature that we're going to look into today is focusing on the effects of mindfulness in mental health, specifically anxiety and depression. And these effects were actually maintained long term. Mindfulness has been shown to be as effective as antidepressants in the treatment of anxiety, as well as effective as antidepressants in preventing the relapse of depression. Mindfulness has also been shown to reduce emotional reactivity and promote deep listening and communication. And so let's get into the science behind mindfulness. I'm going to focus on 4 studies that actually look at mindfulness in anxiety and depression. However, there are a lot of research and studies on mindfulness and its benefits, and particularly its health benefits, that I have down in the description. So if you're interested in learning more about all the benefits of mindfulness, I suggest you go down there and take a look at all of those articles that I've cited in today's video so far. So the first study I want to highlight is by Yang et al. And this study came out in 2016 on the state and training effects of mindfulness meditation on brain networks that reflect neuronal mechanisms of its antidepressant effect. So in this study, it was an 8-week, 40-day, so 5 days a week, mindfulness-based meditation training with 13 participants. And what they saw with these participants were neuroplastic changes. And these neuroplastic changes were observed using functional MRI images. And what they found is that in areas of the brain, such as the default mode network and anterior cingulate cortex, and these types of changes that occurred in these different areas and different parts of the default mode network and the anterior cingulate cortex were changes that are thought to improve emotional regulation, attention, and overall mood. So this mindfulness-based meditation training actually changed the person's brains. And so that is what they were saying is underpinning a lot of the changes that are happening to help improve mood and anxiety. The next study I want to highlight is a study that was done just recently in 2023 by Hodge et al. On a mindfulness-based stress reduction versus escitalopram, which is Lexapro, an antidepressant, for the treatment of adults with anxiety disorder, and this was a randomized controlled trial. Now, this trial took a sample of 208 patients that were diagnosed with an anxiety disorder, and they were randomized to either 8 weeks of this mindfulness-based stress reduction training or given escitalopram or Lexapro 10 to 20 milligrams. And what they did was they measured the anxiety score at baseline, then at 8 weeks, 12 weeks, and even 24 weeks. So even after the 8 weeks mindfulness-based stress reduction training was over, these participants were still being measured at 12 weeks and 24 weeks. So that's very important. So this is just an 8-week training, and it's being compared after the 8 weeks to someone who's continuing to be on medication like escitalopram or Lexapro. And what they found was that this mindfulness-based stress reduction training was as comparable to the effectiveness of the escitalopram or Lexapro with minimal risk and, of course, minimal to no side effects. So that to me is amazing, that we can have something, a skill that you can learn and hone in that could be just as effective as medication without all of the baggage. That's just amazing to me. And the next study is just as amazing. It is a study by Siegel et al., and it was done in 2010. So this was before the Lexapro study, where it looked at patients on antidepressant monotherapy versus sequential pharmacotherapy and mindfulness-based cognitive therapy or placebo for the relapse prophylaxis in recurrent depression. So they're comparing mindfulness versus someone staying on a medication versus someone given a placebo as to whether or not these people will relapse in their depression. So this study took a sample of 84 patients who were in remission. They were randomized to either continue their antidepressant, stop their antidepressant and take a placebo, or stop their antidepressant and do an 8-week mindfulness-based cognitive training. Now, these participants, all of them, including those in the 8-week mindfulness-based cognitive training, were observed for a total of 18 months. So that's a year and a half. So this training is only 8 weeks, and these participants are being observed for a year and a half. Now, 66 participants completed the study, so they did have some participants dropping out in each of the groups for various reasons. And what they found was that the patients in both the mindfulness-based cognitive therapy as well as the medication group showed a 73% decrease of harm compared to those in the placebo group. And when they looked at the adjusted relapse rates for each condition, 27% of patients who were on medication relapsed, 28% relapsed who were in the mindfulness-based cognitive training, and 71% relapsed in the placebo group. So again, that to me is amazing to show how mindfulness-based cognitive training can actually help to prevent patients from having relapsing depression, and so should be used after a person is on an antidepressant for a short period of time to get them over whatever situation they're in. They can then use mindfulness training to carry them on or carry them through so they don't end up relapsing in their condition. And the last study I want to highlight here was done in 2015 by Gu et al. And it's how mindfulness-based cognitive therapy and mindfulness-based stress reduction, so looking at both of those, improve mental health and well-being. And this was a systematic review and meta-analysis of various meditation studies, and this is particularly looking at the psychological benefits of these mindfulness practices. And so what it showed was that the psychological benefits of these different mindfulness practices were the following. There was strong evidence to show improved cognition and emotional reactivity. So emotional reactivity is how you're responding to your environment emotionally. So mindfulness improves that, as well as can improve cognition and have cognitive benefits. There was moderate evidence on how mindfulness decreases rumination and worry. And rumination and worry are what underpin many of the anxiety disorders. And so mindfulness and anxiety can be helpful there. And then there was preliminary but insufficient evidence to support mindfulness for improving the self-compassion and psychological flexibility. And psychological flexibility is somewhat like the emotional reactivity, how you're responding, but it's mainly your ability to also adapt in different situations emotionally and mentally. So it's like having resilience in certain situations. That's what psychological flexibility is all about. And so after looking into these 4 research articles, as well as all the other articles that are listed in the description, what are the final thoughts, or what are my final thoughts, or the bottom line of mindfulness meditation and mindfulness-based practices? Well, obviously mindfulness has demonstrated efficacy in the treatment of anxiety and depression and has shown benefit similar to medication. However, mindfulness has less risk and more benefits when you're looking at the two, medication versus mindfulness. That risk-benefit ratio is going to weigh more on the benefit than the risk. When you're looking at medication, you have a slew of side effects and potential drug interactions and things that you have to be aware of that can weigh heavier on the risk versus benefit side. That's why I base my practice on emphasizing skills versus pills. But I also don't want you to misconstrue this evidence or this video as saying that mindfulness is going to treat your depression and anxiety. Mindfulness is all you have to do. Because mindfulness is just a part of what you have to do. You see, mindfulness isn't going to correct the gut-brain axis. Mindfulness isn't going to correct your lifestyle. It's not going to produce all of the benefits of, say, exercise or correct your diet. If you're eating poorly, it's going to be difficult to overcome nutrient deficiencies or inflammation because of the inflammatory foods you're consuming if you're also using mindfulness. And so mindfulness is a tool, it's a skill, it has shown efficacy, but it should be used in conjunction with lifestyle changes. And that's where I see in clinical practice the best results, is when you're incorporating mindfulness as part of a lifestyle, as well as doing other things to support your mental health, such as dietary changes and lifestyle changes, such as exercising, stretching, improving your sleep habits at night, and also improving your mindset. Mindfulness can help with improving mindset, especially mindfulness-based cognitive therapy or cognitive practices that help you to become more aware of those negative thoughts. But cognitive behavior therapy in itself can also help improve this negative thinking pattern that we automatically go to. So in combination, those two can do wonders for depression and anxiety because you're hitting the root cause of these two different conditions. And so that's what I like to emphasize, is that whatever you decide to use to treat your depression or anxiety, make sure that you do your homework first and look for the root causes. Look for your nutrient deficiencies. Look at your diet. Are you eating inflammatory foods? Maybe that's why your omega-3s are low and your inflammation markers are high. Also make sure that you're looking at things that have happened in your life. Are you experiencing trauma? And perhaps a lot of this is stuck in the body, where yoga and mindfulness can work very well together. Or you can do somatic therapies to help release the trauma in your body. So overall, mindfulness is helpful. And mindfulness should be used as a first-line treatment, along with those other things that I've mentioned. Looking for the root causes, adding in some other types of therapy and modalities to help treat the person's symptoms of depression and anxiety. So I hope that you found this video useful. And if you've had experience using mindfulness, I would love to hear about your experience and love for you to share it down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you all for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.